morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. As I was sharing before the break, we were talking about the markets, how to invest, safe money alternatives. It's a good time to look at that. I know I get calls every week about the I-bond that, there's one, and you can't put a lot in. It's like $10,000 a year. But, it is an option, in particular at this time, and relatively short. I mean, you can go in for as little as a year. If you come out after a year, or if you cash out after that first year and prior to 5 years, you'd have a 3-month interest penalty. But right now, I think it's somewhere over 9%. Now, it's going to change and fluctuate, but usually you're just, if you're giving back 3, that's only 25% of what you were earning anyway, so it's still not a bad idea. If you keep it for 5 years, then you don't have that penalty. Something to look into. Treasury Direct is the place to go for that. One of the things that we also look at, bank money, of course, whether you're talking savings, checking, money markets, CDs. Rates are still low, but they are starting to come up. Short-term fixed annuities right now, we're seeing some of those coming in the 3 to 5 year range at about 4. Well, anywhere, if it's 3 years, it's probably down to 3.5 range. I don't think I've seen one at 4 yet, but it's a 5 year. We've seen 4.5 and growing. And I think that's going to continue to be the case as interest rates continue to go up. Unfortunately, we're seeing the other side of that, like mortgage rates, which are up. I think I saw yesterday they went up to 6.29% now on a 30-year mortgage. So that's an incredible jump over the course of a year, more than double on the mortgage rates. And that's, again, this is where we're going to see this dampening down of the economy, slowing down of housing. That's going to affect a lot of different areas. And of course, as people, we're also listening about companies, right? We're seeing that in the news about companies potentially cutting back or hiring freezes, or in some instances even laying people off. This is all part of a recession and the pain that kind of goes with that. If you're retired already and you're on a fixed income, you're not as subject to that part. But of course, the inflationary that we're seeing at over 8% most recent, and in reality, of course, probably double digits, especially on many of the things that we spend money on. So when we see that part, we see our purchasing power is what we have to watch. So when the markets are down and inflation is high, we're getting hit on both ends. Our money's gone down in value, or gone down in terms of real money, as well as the value of those dollars being affected by higher prices. All of this to say, it's a great time then to be thinking, first off, discipline, but it is a good time to reassess. If you're invested in such a way that, potentially a company could go out of business on an individual stock, you don't want to sit on that. If you've got maybe some weak mutual funds or ones that are really way underperforming, staying in the market doesn't mean you have to stay with the same exact investments that you have. Maybe a time to reassess that and look for places to better position yourself. The other is, when it comes to weathering a bear market, a great time to reassess where you're at, take inventory of your overall plan. So when it comes to Medicare, we're coming up on Medicare enrollment, an open enrollment period. It might be a way to cut costs there on your Medicare premium, for instance, or on your healthcare costs in general, ways to keep more of that money in your pocket. And we're going to talk about that in great depth, or more depth today. In addition, Social Security, take a look at where you're at with that. How you're, pay on your taxes. This is a great time to see if there's any kind of tax planning that might help you reduce your taxes. So it's not only about looking at your investment, it's looking at your overall plan and looking for ways that you can cut costs or reduce risk, of course, and as well as something that's going to help you improve your returns overall. So a great time to do that, and I'm going to help you with that. In fact, if you would like to get a comprehensive financial plan done, a personalized plan for your situation to help you in times like this in particular, then just call my office. That number is 615-376-5325, and I can assist you with that. We'll look at your income. We'll look at your expenses, assets, liabilities. We'll factor in for inflation, taxes, rates of return on your money, and ways that we can help you, in particular when it comes to income. This is a time, if you're retired, it's all about how do I make sure I can maintain my income through this period, a stable income, an income that's going to increase, but certainly that's going to be able to, this is, for many, if you're totally dependent on your portfolios and you're invested very aggressively and you're pulling income from them, this could be really dangerous time to be doing that. So it's a good time, again, to assess what's the best way to get income, to minimize taxes while you're taking it, especially from retirement accounts as an example, and to make sure that that income is going to be stable even through rocky periods like this in the market. So again, just call our office, 615-376-5325. We'll get your information, send you out a checklist of things to bring to your appointment with me. And when you come in to see me, I'll also give you a free copy of my book, 7 Steps to Financial Freedom in Retirement. All right, we talked enough about the markets for this morning. And we're going to segue over to, I've got a special guest in today, Warren Cranford. He's a benefit specialist, and we're going to be talking about Medicare and healthcare costs in retirement. This is one of those areas, and when you think about it, and we're going to expand on this a little bit, but I've seen studies showing for a married couple age 65, out-of-pocket costs anywhere from $250,000. I've seen as high as well up over $400,000 over their lifetime. So have you planned for that expense? Have you? This is what I was saying about when the markets are like this, and when we see this kind of volatility, it's a great time to just reassess everything, including Medicare, and say, you know, an area when you've got, when the markets are going really well, everything's floating along, you got extra money coming in, and maybe you're not really paying that much attention, and maybe, you know, you're paying more for something than you might need to pay, that there are other ways to go. Just like when it comes to taxes, people pay more than they're legally required to pay simply because they don't understand the rules, which is why we try to keep you informed and educated about tax laws and the way the system works and how you can use it to help reduce your taxes. Same thing goes here. We're going to talk about how to reduce your healthcare costs. So Warren, this is one of those areas, and right now we're coming up again on open enrollment. So why don't you talk, in fact, to start, when open enrollment starts, what that period is and what it means for those that are already on Medicare.
Thanks, Hank. Appreciate the opportunity to be here with you this morning. Open enrollment begins October the 15th, and it goes through December the 7th. And so it's just right around the corner. And you can start looking at the plans for 2023 beginning October 1st. Applications can't be sent in or accepted until October the 15th. And so that's a perfect time, as you were saying, to reassess. Right. This time of year for folks, especially that are already in a Medicare Advantage or Medicare supplement, Medigap or supplemental plan or a standalone drug plan. Perfect time to do some reassessing, just to make sure that they're in the right place.
So this is one of the things when it comes, and we're going to talk too about for those of you that are turning 65 this year, or this year, next year, whatever, that that's coming up, and what that means to you, what kind of choices you're going to have to make when it comes to that. And our first slide is kind of cute. It's information overload, and this is from the Nationwide Retirement Institute. So we're going to share with you basically some things that go along with that and fill in some pieces for you and how it might affect you. There are many significant milestones in life, such as graduation, buying your first home, maybe becoming a parent, turning 50, and who remembers all the mail that showed up for the senior discounts, right? Once you hit 50, all of a sudden it's ARP memberships and all kinds of things at you. And then now, approaching some other milestones, age 62, that's the first time in which you qualify to start taking Social Security, if you desire. Now, of course, it's going to be discounted down. You'll get more if you wait. But the other is Medicare at age 65, your full retirement age at age 66 to 67, depending on your date of birth, and what that means with regard to Social Security income. And then, of course, age 70, that's when to maximize your Social Security benefit. That's the longest you would wait for that. And then, of course, age 72, when you have to start taking required minimum distribution. So there are all these different milestones. We're going to be talking about, in particular, that one of Medicare. Okay, so at age 65 is when you're first eligible. And let's see what we've got here. get my papers all squared away. All right. So here we go. We're going to be talking about what is Medicare and when do you enroll, the different parts of Medicare, their coverages and their costs, supplemental policies, and Medicare Advantage plans. So a lot to cover with you that'll help you keep more of your hard-earned money in your pocket and less going out for things like healthcare costs. All right. Join us here. We'll be right back on the Retirement Report.